From the nation's capital in Washington, D.C., the Congressional Report, with your host, Iowa Congressman Tom Latham.
This country is based on farms, on small businesses, and creating jobs and opportunities. That is the lifeblood of this nation.
And now your host, Congressman Tom Latham.
Hello and welcome to the Congressional Report. The national health care discussion has been intense and spirited during this last year, but the discussion has often neglected the growing nursing shortage that is threatening American health care. As a means of addressing this nursing shortage, I've introduced bipartisan legislation to help schools train more nurses and get them into the workforce. At a time when bipartisanship in Congress is becoming less common every day, I've worked across the aisle with Democrat Congresswoman Tammy Baldwin from Wisconsin to craft this legislation. Joining me today to discuss the nursing bill is Congressman Baldwin. And welcome, Tammy, very much. Thank you for joining us, and it's great to have you with us. Tell us about where you're from and where your district is and about you.
Yeah, well, first of all, thank you for having me on, Tom. I really appreciate the opportunity to highlight some of our work together. I represent a district in south central Wisconsin. We're neighbors, and my district is very diverse. The biggest city is the city of Madison. It's about a third of the population of the district that I represent. And then there's a suburban area and rural area around there, especially a dairy farming region of the country. And so it's almost equally divided between urban residents, suburban residents, and rural residents, which is a delightful district to represent. In terms of my own background, I actually first ran for public office because of my concern with the healthcare system. And of course our work together fits right in with that. But I would tell you, and I'm sure you're facing the same issue, that in this deep recession that we're in, that our focus is very much today on jobs. Jobs is the number one focus. And actually this legislation we worked on together really hits my two passions, jobs and ways in which we can improve our healthcare system.
My youngest daughter worked 2 years in Madison. It's a great community. She loved it there. But, you know, nurses are really on the front line of our health care and providing services to your district, somewhat like mine. You have maybe a few more young people, but we have a lot of people in nursing homes that require a lot more care today. Just to step back and talk about the nurses themselves and the part that they play as far as providing the health care.
Well, they're central, and if you're a patient experiencing the healthcare system, most of your contact is going to be with nurses. If you're in a clinic setting, if you're in a hospital setting, that's going to be really your interface. That's the face of medicine today. And nurses are particularly critical in the mission we have of preventive health care and primary health care. But also when you have individuals that have chronic conditions that need sort of continuing care and monitoring, it's usually not the doctor who calls and makes sure that they come in and have that test or remind them that something is necessary and make sure that they're following up. It's usually the nurse who's having that main interaction. And so when you look at the health of our population, nurses really are, as you say, in the very front line of delivering primary, preventative, and chronic care.
And I always think that nurses are the face of healthcare. When you go in, your family comes in, they're the ones that interact. My mother, just had a stroke here a week or so ago. And, the person you rely on to get the information, the face of it is that nurse there, and they do a tremendous job. And we have a real problem with a shortage as far as nurses. What in Wisconsin, or what are the numbers, I guess, as far as what the shortage is there, and what do you see nationwide?
Well, in Wisconsin, we are definitely challenged by a shortage of nurses with various nursing degrees, and I would say it's a very ironic situation right now because of the recession, clinics are not necessarily hiring, but the demand is absolutely there. Also, you talked a little bit about the elderly population. We know that as a nation we're aging, and Wisconsin is no exception. And as baby boomers become senior citizens, it is very likely that they're going to develop chronic conditions that require care, a higher level of care. And nurses, as we said, are in the front line. So as we age, as we hopefully through healthcare reform cover more people, the demand is only going to increase and the shortage is only going to magnify. And we find that our nurses who are in practice are closing in on retirement years. I know we're going to get into a lot more detail in a moment, but I talked to the dean of our nursing school, the one that's headquartered in Madison at the University of Wisconsin-Madison, and she reports to me that in the next 5 years, 65% of her faculty members will be eligible to retire. Now, we hope they don't. We hope they stay in extra years because we really need them right now. But that's not unusual, and that's not atypical of hospital settings and clinic settings and solo practices with nurses helping a solo doc. This is happening across the country.
I know in Iowa, I think it's about 49% of the faculty will be eligible to retire this year in 2010. Some of the numbers are a couple years old, but we had a shortage in Iowa, I think, of about 2,300 nursing positions right now. Nationwide, I think it's over nearly 120,000 positions that are open. And so there is such a drastic need, and that in 10 years, from the numbers I've seen coming from the nurses themselves, that we're going to be short about 1 million, especially when all of us baby boomers get in, like you mentioned, and that's me. So
that's right.
but in Iowa, I know the reimbursement issue, as far as Medicare is an issue, as far as what we can pay nurses to be competitive. Is that as much of an issue in Wisconsin, or is the Medicare reimbursement issue a factor, do you think, as far as salaries?
Well, you have a lot of factors. First of all, even within the state of Wisconsin, rates are not consistent throughout the state. And I describe my district as part urban, part suburban, part rural. The challenges facing rural hospitals, critical access hospitals, rural clinics in attracting and being able to fill their positions are different. And some of it does, in fact, relate to the reimbursement, whether it's private pay, Medicare, or Medicaid. But part of it also relates to the cost of living in certain areas, how far somebody might have to commute if a spouse or someone works in a different community. And so these are issues that we experience throughout the state of Wisconsin right now.
You know, the bill that we're working on together, which I think really addresses one of the major problems we have, and that's within the nursing faculty.
Right.
And that is one of the biggest roadblocks, is just capacity for the nursing schools because of the few numbers of faculty they have. Do you want to talk about the details of the bill itself?
Sure. Well, let's just first sort of put the problem out on the table. Senior nurses who are very desirable to have as faculty members because they have not only their academic knowledge base, but they have been practicing along in the medical system, and they bring that know-how to the classroom. So we hope to recruit our future faculty members from the ranks of nurses who are in practice today. But they are paid more usually in a hospital setting, or a senior clinical nurse is going to get more in that capacity than they are as a faculty member at most technical colleges or even world-class universities. And that fact, sort of putting that fact on the table, is one of the first things we need to recognize is the correct incentives aren't in place. Compound that with, we're going to ask them to go back and get a master's or a doctorate level degree to be a faculty member, and that's going to cost them money, and they're going to be away from work as they're earning that degree, so they've lost some income, if not all of their income. And you get to this problem of, why would anyone do it?
Right.
And so it's been a pleasure to work with you to figure out how to move those obstacles and move those roadblocks to getting more faculty in the pipeline. And I think this bill confronts one of the largest obstacles, which is paying for their education, paying for that master's degree, that doctorate level degree that enable them to be well prepared as a faculty member.
Well, it's obviously several roadblocks. One, along with exactly what you're saying, but that nurse oftentimes is maybe the primary income source for the family. Oftentimes is the person who provides the health care for the health insurance for the family at their place of work. Under the current constraints that we have, they cannot go to school and continue to work, or they're not allowed to get the help as far as tuition. And so it's either work full-time or go to school full-time, and they have to give up your income, you have to give up your health insurance to do that. They're simply not going to do it. So the one thing that our bill does is say that you can, in fact, continue to work and go to school at the same time to get that advanced degree. And I think that is very, very important as far as what we're trying to do as far as to improve the numbers. Nationwide there are, I think, about 40,000 applicants today, to qualified applicants that are denied because of the shortage.
It's getting even worse. Right. The number is going up all the time.
Yeah, and which obviously we need these people in the workforce. But
in Wisconsin, I think last year, or at least the last year for which we have data, almost 1,000 young people who were interested in going into nursing were waitlisted or denied a seat at one of the institutions that provides nurse training. And it was not for lack of qualifications or ambition or anything. These folks are anxious to fill the ranks, know that they're desperately needed, but it was because of the limitations with regard to nursing faculty, that we don't have enough out there right now to teach the new workforce that we need so desperately.
And the Midwest states like Wisconsin, Iowa, I think have a larger problem maybe than some of the urban areas because of the pay scale. But talking about that, if you're a practicing registered nurse, you're probably making, 20% more than what the faculty is? And I mean, that's we've got to find a way to make that more equitable also, because it certainly is a disincentive to become a faculty member. Now, you may think the hours are better, but you talk to the faculty, and they're there day and night too. So.
Oh, absolutely. They're very dedicated to their jobs, and in these economic times, people have to make rational and pragmatic decisions about their jobs and how much income they can forego for something perhaps that's more fulfilling, or something that they just look forward to doing. We see people putting off retirement. In fact, our nursing crisis would be worse if some of the retirement eligible nurses were actually retiring today, because we have a recession and people are very mindful of these issues. They're staying in longer. But yes, these are real choices that families make about foregoing a dream to be a professor because it won't help make ends meet on a month-to-month basis the way their current job does.
Now, I did a series of meetings around the state of Iowa talking to community colleges, University of Iowa, School of Nursing. We had big hearings, and it was really fascinating to me to hear the faculty side of it, in that they really, there's their commitment, obviously day and night, that they're there because they are so dedicated, just as nurses are, because they want to help people, and they actually get great satisfaction out of nurturing and tutoring young people coming into the profession. But they were talking about how it is difficult today because of oftentimes they're asked to work, the regular RNs are asked to work overtime. They have unusual hours oftentimes, and so I don't know, the things that you think we can do. I don't know how you actually approach something like that, but I guess by approaching the shortage, you're going to eliminate some of those problems.
Well, certainly, and you know, this bill and other measures like it are such win-win situations, because if your district is anything like mine, you have people who are out of work. I'll give you an example. In my area, we've had really major hits in the auto industry. So you have a whole workforce that's ready for retraining, looking at mid-career changes. Many have literally expressed interest to me in saying, well, where are the areas of high demand where I can give back to my community, and have some interest in going back to school, in getting a new degree, and trying a new second career. We have this pool out here that's eager, willing, and able, and smart, and hardworking, and this frustration of the bottleneck of not being able to offer them the placements in the classes. But I think you're also right that beyond the reach of the legislation that we've been pushing together, that we do have to change other incentives. We know how important primary care is in medicine, and we know that doctors increasingly are specializing, which means the burden is shouldered more by nurses to be the major players in preventative and primary care. We need to make sure that that they get paid for their hard work in a fair way, and that means looking at, as we were talking earlier, Medicare reimbursement, the state's role in Medicaid reimbursement, to make sure that they're getting fairly compensated for the very hard and important work they do.
Is it a problem in Wisconsin? I know it is in Iowa and in some areas, in some schools, to find hospitals that have openings for their students to go in and to get the on-the-job experience that they need. Is that a major concern there, or is that some areas it's a real problem, some areas, in the rural areas it's a problem?
Right. I would say that again it's regional in Wisconsin where you're going to have that challenge, and when you're not. It tends not to be a tremendous problem in some of the urban areas where there are a number of teaching hospitals that are experienced with both training doctors and training nurses. And we have a number of those, particularly in more urban areas. But if your focus is ultimately wanting to practice nursing in a more rural or suburban setting, some of those placements can be a little bit more challenging.
What have your nurses said about the legislation? Are they excited about the idea of the opportunities it will bring them?
I was struck when we first introduced the bill several years ago how far and wide word traveled so quickly, because I think we had no sooner had we introduced it than I was in my district, and I think the first contact I had, I was in the supermarket. I wasn't even, doing a hospital tour or anything like that. And a nurse came up and said, "I heard about the bill. We're very excited about it. Tell us what we can do to help push it."
Yeah. Well, and I think as we work together to try and push it forward, I think it's people should understand, and that's part of our story here, to tell other members that there is tremendous support out there, and that these the nurses are the people who not only treat on the medical side, they treat the patient and they treat the family. I mean, that's such an important part. Are you seeing a lot of young people wanting to go into the nursing profession. Obviously, we have a lot of candidates for schools that are being turned away today, but I think it seems in Iowa that there are a number of people who understand that once they get their degree in nursing, that they're actually very mobile and they can go anywhere and get a job because of the shortage. But I don't know if you're seeing the same thing over there.
Well, I am, and I'm seeing that trend for a number of reasons. I mean, nursing, the profession has changed and evolved a lot over the years. And in many settings, nurses have more autonomy than they had if you think back a couple of decades, where it was a very hierarchical way of practicing medicine in this country. Now we often have settings where a team approach is taken, where innovation is happening, and in the workplace the opinions and recommendations of all levels of people of all levels of training are being heard and incorporated. I think nurses who get a chance to pick that type of environment to work in, or are lucky enough to be in that type of environment, are really thriving, and word is getting out that nursing isn't the career that it used to be 20, 30 years ago. Nursing now is it can be very autonomous, it can have lots of responsibilities, and feel like you're making a difference every day.
You know, the legislation that we have it goes to, and it's a different level as far as they're getting a master's degree or getting a PhD degree in nursing, and $40,000 as far as the loan repayment, $80,000, or that was for a master's degree, $80,000 for a PhD.
That's right.
Is that enough of incentive? I mean, especially in some. You're probably not going to get a nurse to go out into a rural area and have low payment as far as their services there and have all this debt that they have, and certainly be able to afford that transition as far as becoming a faculty member also. But
if what you're getting at is will our work be done when we pass our bill? The answer is no. It won't
we know
be.
better than that.
We know better
here.
than that.
Yeah.
But this is a critical step, especially as we need to deal with the most significant part of the crisis, which is right now in the faculty. You can't address the rest of the crisis that follows in the field if we don't have the teachers there to prepare these nurses. But yeah, I think we really do have to look well across the board at the incentives out there, and you know, now is a time where there's a very rich and significant public discussion occurring about all aspects of our healthcare system. Certainly there's the debate happening in Congress, but across the country people are saying, how do we deal with the fact that our country is aging? How do we deal with the fact that too many in healthcare are specializing and not focusing on primary and preventative care? We really do have to look at system redesign, and nurses are going to play a key role in that.
Right.
Their voices are so important in informing that debate.
Well, how much of an impact, I don't know if you've been visiting with your nurses and faculty also, but just the working conditions sometimes that nurses have to deal with. I mentioned earlier about overtime hours and how they are on the front line all the time, which a lot of them love. I mean, their first thing is to give care. I mean, that's why they do it. But do you see other obstacles out there? I mean,
yeah, it's been episodic in the communities that I represent. There's been times where certain hospitals have felt that they've needed to have mandatory overtime, and I've certainly heard very significant concerns expressed in the nursing community at times when that's been implemented. Fortunately, many of the settings where that's happened in the past are not needing to resort to those policies at this point in time. But nurses report to me that that's when mistakes happen, when you're exhausted, when you're on your end of your second shift, and it also contributes to stress and a lower sense of quality of work life. if that mandatory overtime means you have to figure out something with childcare and other things,
sure.
There are concerns obviously that arise. So there's many reasons why we want to confront this shortage.
Do you think there is, and you mentioned it, that's when mistakes can be made. You really get to the point where if the shortage gets so severe that there is a safety issue as far as the patients and and the nurses have such a huge responsibility, and especially now we're going to more technology and all this, that they have to update some of their skills.
Right.
But I mean, it's very complicated today.
Well, I mean, the good thing about the technology is that can be a check and balance.
Right.
Technology and electronic medical records, I think, help nurses and physicians and patients make sure that the steps are being followed or avoiding drug interactions and things like that. But there's absolutely no question in my mind that if you have to resort, because of a workforce shortage, to policies like mandatory overtime that cause stress and cause people to be with patients when they're tired or haven't had enough sleep, that's a recipe for problems, and we want to make sure that the policy that we're supporting eliminates those situations.
To step back, I guess, in my opening I talked about working on a bipartisan basis. That's the way we get stuff done actually around here. And I think it's frustrating for you, like it is for, I think, a lot of us, that it would be so much nicer if we could work like this together more often and do things, because I think the frustration we see out in the country today is that no one really cares about them. It's all about what happens in Washington, and I think that's the only way we solve this problem and a lot of other ones too. And you're such a pleasure to work with anyway.
As are you. I very much appreciate the chance to work on this bill with you.
I think the opportunities for nurses obviously are going to be very good for a long period of time out here, and it's such a great, noble profession that people sacrifice so much, I think, and because they want to help other people, and it's the caring part of it is what it's all about. But regular and RN, do you have any idea today how much debt that they would carry when they get? I mean, we know what the graduate students would, but
for a four-year degree, it's not at all atypical for somebody to be carrying $60,000–$70,000. I think that the average across all fields in the University of Wisconsin is $25,000 for a four-year degree. When you're looking at masters and PhDs, obviously it gets higher in the areas that we were talking that our bill addresses.
Well, we'll work on it, get it done, right?
That's right.
Thank you so much for being with us today. Nurses are so often the face of healthcare in this country, and the work they perform is critically important to our healthcare system. But a growing nursing shortage threatens to become even more serious in the years ahead if we don't act. If we're serious about improving American healthcare, nursing must be an important part of the solution. Thank you for joining me, and please tune in next time for the Congressional Report.
From the nation's capital in Washington, D.C., this has been the Congressional Report with Iowa Congressman Tom Latham. Have a question, comment, or concern? Congressman Latham wants to hear from you.